Okay, so estrogen. Who's a candidate for estrogen replacement, and what's it responsible for women?
Okay, well, what happens as we get older is a lot of our beneficial hormones, they go down. Typically the sex hormones, they go down with age, but the bad hormones, or the hormones that actually cause illness, such as cortisol from stress and insulin from poor diet and whatnot, they tend to go up. So estrogen, for example, is one that when it goes down, you lose the benefits of the estrogen. So hormones are beneficial. It's when the hormones go away that you lose the benefit. So when you lose the benefit of estrogens, you start getting moody, you get irritable, you start gaining abdominal weight, you have vaginal dryness with painful intercourse, you lose your libido or sex drive, you start increasing your risk for things like cardiovascular disease, Alzheimer's, and other mental memory disorders. Estrogen is actually very protective for those issues, which are common as you get older, as well as estrogen is very helpful in maintaining bone density. And without adequate bone density, you start getting fractures and whatnot. So who needs estrogen is really anybody who has any of these symptoms, or if they simply want to prevent some of the natural aging illnesses that are very common in the United States.
Now, is estrogen one of those things in your practice that you're combining with other hormones?
Yes, estrogen we typically combine with progesterone because you need to balance the estrogen and the progesterone, as well as testosterone, thyroid, and other very commonly depleted hormones in the perimenopausal, menopausal, and beyond ages. Although we don't use estrogen replacement until someone is declared menopausal. So once we get the estrogen back to an optimal level, then life starts to return. I mean, you start feeling better. You're having more energy. You're sleeping better. You're not having hot flashes, night sweats. You're able to engage in a reasonable sex life again because you have the loss of the vaginal dryness and the sore symptoms. So what we really want to do is get the estrogen and progesterone balance, and they're both hormones that tend to lose their levels as you hit menopause or perimenopausal levels. So we get them balanced, and you start feeling better.